Hello, how are you?
Hi, I'm good. Thank you for joining me for Medication Monday. I'm taking over for Emily. You may know
Okay.
me, Ashley. Throwing all the questions at you. I'd like to talk with you today about Lamictal. Can you tell us about
Lamictal. Yeah, absolutely. What would you like to know about Lamictal?
everything? Well, why am I being prescribed Lamictal first?
Lamictal, okay. Well, Lamictal is an anti-seizure medication, but it's also a mood stabilizer. In psychiatry, we use it for mood stabilizing folks who have bipolar disorder or who have major depression. We sometimes use it for the depression component for that. And then neurologists will prescribe it for seizures to help control seizures. And so those are its main indications or reasons that we might use it in neurology or psychiatry.
Right, what are the side effects?
From Lamictal, yeah. So Lamictal is known to cause something called Stevens-Johnson syndrome. It's the main side effect that we all look out for. Stevens-Johnson or Stevens-Johnson syndrome is the name, I think, of two doctors combined. And it's a syndrome where folks get a rash, but the rash tends to blister and can cause a burn. And if that goes on and the medication isn't stopped, then folks can end up going to the hospital and you can die from the rash. So it's very dangerous if it were to happen. And so when I'm prescribing it, it really can work very well, the medication, but it always kind of freaks patients out because they hear about this terrible side effect and then they may become skittish about taking it. The good news is it's relatively rare enough to where it doesn't happen that often. When it happens, though, the doctor has to have a conversation with the patient that day and examine them and give them guidance. For example, I had a gentleman call me one time who had a rash on Lamictal, and when we worked it up and I examined him, I actually had him see a dermatologist colleague of mine, and the dermatologist diagnosed hot tub folliculitis. So he just had a bacterial infection from being in an actual hot tub. So it wasn't the bad rash. So we kept him on the medication. But aside from this rash business, Lamictal has very little side effects at the lower doses. It's pretty well tolerated. It doesn't cause much weight gain, so patients often like it for that reason. Whereas other mood stabilizers can cause weight gain. It doesn't cause sexual side effects or lower libido. It doesn't make folks too foggy in the lower doses. However, there can be tons of side effects that are rare, and when they happen are not fun. Like your hair can fall out. You can get a benign rash. So it's not the bad rash, but it's a benign rash. Sometimes it can cause low red blood cells or low white blood cells or low platelets. And those are lab tests that we get for folks. However, most of the time we don't run into those problems and it works quite well. The only other thing is when we start the medication, we have to start at a low dose for about 2 weeks, and then we bump it up to the next higher dose for another couple weeks. Those doses are relatively low compared to the treating dose. And the reason we do that is to prevent triggering the bad reaction, the Stevens-Johnson syndrome. So that's kind of Lamictal side effects in a nutshell.
How long does it take to start working? How will I know that it's working for me?
Yeah, that's a really good question. Folks who are diagnosed appropriately with actual bipolar disorder, they tend to feel better sometimes within a couple weeks, where they say, hey, I'm tolerating this much better. A lot of patients have taken things like SSRIs, like Prozac or Lexapro, and patients who have bipolar disorder who take those medications, and those medications are not typically indicated for bipolar disorder. And sometimes those medications can worsen bipolar disorder. So a real neat thing for me is when a patient comes back and says, I'm on a low dose of Lamictal, I don't have any side effects, and I actually feel better, like my mood's a bit brighter. and they're not cycling up and down as much, or their downs are more normal and their ups are more manageable. So that can happen within a couple weeks. And then if it doesn't happen, we usually go to about a month, where I will look at their clinical improvement. And if they're not feeling significantly better, we'll go from 50 milligrams on up to like 100 milligrams. And you can typically raise the dose more rapidly week for week once you hit 100 milligrams, because the doctor and the patient know that they're tolerating it well and they're not having the bad rash. But remember, this is not medical advice for anybody listening out there, directly for you. That I would always ask your doctor about whether this is right for your diagnosis, clarify your diagnosis, and always have informed consent as to what the risks and benefits are to the medication.
All right. Thank you.
Okay, you're very welcome. Thanks. See you next time.